Natalie, thank you so much for taking the opportunity to sit down with me today. I really appreciate it. As a physiotherapist myself, it is something that I've always, number one, I think dreaded when I was a younger physiotherapist. Like the president must be somebody that is completely out of my brain space. I wouldn't even be able to hold a conversation with you. But now, having been in the profession for a while and really understanding the work that you do, I understand that you are very much in touch with what the local physiotherapists and the physiotherapists is even starting out, what pains and problems they go through. So again, thank you so much for taking the time to sit down with us. And I want to start out by just saying that you actually have intersections in healthcare that go beyond physiotherapy. You also are involved in medical legal work, and in your capacity as SASP president, you also have to do some consulting work where you're chatting directly to physiotherapists and subcommittees. But I do want to ask you a very poignant question to start out with. And that is, what are some of the challenges that you find that are facing the profession of physiotherapy in 2024 and perhaps beyond?
Thank you very much for having me, Basil. And yes, I hear, as a young physio, you don't see yourself into the future. And I'm just me. I'm just another physio who's passionate about the profession and who felt that I needed to get involved to make a difference.
Yes.
It's easy to stand on the sidelines and critique, but you actually need to get your hands dirty. In terms of the challenges that we face, I think there are many. In our context specifically, I do think that the NHI is a huge one for us, and how we're going to fit into that. But before we get there, I do think that technology is rushing way faster than we can keep up from an education perspective. And it's purely because the world is changing. How we learn is changing.
Yes.
But how we teach has remained the same for the longest time. So I think one of the first things that we need to look at is how to educate or prepare our undergraduates for the changing world to make sure that, they still meet the needs of our communities out there, but are able to develop themselves as individuals and to almost make a statement about what physiotherapy is and how important it is in terms of what we do. It's not just smacking somebody's chest in the ICU.
Yes.
Or taking them for a walk in the ward. It's beyond that.
Yeah,
it's about making a difference in people's lives. Another challenge we have is the caliber of our students and the personal traits they have in terms of, this is not about me, this is about my patient.
Yes.
And many of them have lost that. So they don't see it as a profession or as a calling. I remember when we were young, it's a calling,
yes.
to work with people and to actually be so intimately involved in their lives. And I think we've lost that. So we've got to find our way back there in helping them understand what it is that we really do. Yeah.
It's interesting that you mentioned technology as well, because now with the advent of AI and tools that have been incorporated with AI, you're also a lecturer. You also spend a lot of time with students and understanding what that next generation is going to look like, and the paradigm that they're going to be operating in, and where they're going to be finding themselves in 5-10 years from now. I'm sure even as a lecturer now, you've had to deal with some ChatGPT assignments.
Many, yeah.
Where you've had to kind of figure out how this actually works, because I don't think it's going away. I think that this is here to stay. We need to find a way to kind of work with this generation and figure out how we're going to move going forward, So maybe you can even just speak to that. How do you think that, since we're on the topic of technology, how do you think that technology is going to shape the future of physiotherapy?
I think it's going to make it better.
Okay.
To be quite honest. It's a matter of us embracing it and understanding that it's always been there. It's just how we use it that differs. And understanding it is very important. And if you think about Microsoft Word, when it first came out, everybody was afraid of it, but eventually you learned how to do it. And it's going to be the same with AI. It's been integrated, like you said, with almost everything we do. It's been integrated into the apps that we use so freely. And how we understand its use is very important. And I do think a big part of what we need to do as the Physio Society, for example, is to educate our members on how to ethically use AI.
I want to touch on that a bit, and I mentioned this conversation might go in a couple of different directions, but clinical reasoning is such a big part of your upbringing as a clinician. Critical thinking, clinical reasoning. And now if you just chuck a bunch of symptoms into a AI device, it will spit out a number of possible diagnoses. It will do a differential diagnosis for you. Do we lean into that? Or do we strengthen the muscle of clinical reasoning and allow the next generation of medical professionals to exercise their muscle to be able to make better decisions on the fly? I'd love your thoughts on this.
Yes, I do think the human factor will always remain and has to remain for us to minimize the errors that come in. And that's what I meant by integrating AI into how we practice.
Yes.
So it's not there to replace how we think. It's there to complement what we are doing. And instead of replacing the reasoning, it's helping you identify, am I making a difference by using an outcome measure, for example? And those are the things that have been digitized mostly.
Yes.
Yeah. But we are not embracing it. Yeah.
And certainly not getting there quick enough, for sure.
Exactly.
Yeah. Yes.
And also understanding that there's a difference between AI-generated information and using an app to inform practice, and using AI to generate a report, for example, which we are seeing a lot of at the moment.
Yes.
That you've actually still got to apply your mind. And if you don't do that, the chances of misdiagnosis is still very high.
You make a critical point, and I want to stay on the topic of the future of physiotherapy for a moment, because the future of healthcare in general, as you mentioned before, is NHI and the conversation that's happening around that. Obviously, different schools and different think tanks and different associations have their opinions about it. That doesn't change the fact that it's been signed into law. It's a law now. There's also another conversation happening around value-based healthcare and about how we as a profession, I'm talking now we because I'm a physiotherapist myself, but how physiotherapy as a profession shows its value in the healthcare marketplace. Not only shows its value to patients, but also to fellow providers and as well to funders. I'd love your thoughts on what physiotherapy and maybe even other allies have to do to be able to demonstrate their value in this new value-based healthcare economy that we find ourselves in.
So you touch on a very important point. As healthcare professionals, we lack data. And the data is, again, which outcome measures are you using?
Yes.
And how are you using it? Are you using it correctly? Are you using it to inform practice, or are you using it to show that you're making a difference? And of course, the latter is important, but in terms of interpreting it, it's not being used well enough, and it's not being documented anywhere. So that national healthcare database of what physiotherapy does for a patient is really, really important. At the moment, in terms of the kind of conditions we deal with, even is an estimate.
Yes, not an exact science yet.
No, not yet. And I commend the Department of Health for actually now introducing ICD-11, which is very more specific about what it is that we are doing. And along with that is the international coding for healthcare interventions. So it's called ICHI for short. And yes, and it's very, very specific about what you're going to be doing. So it is a knee joint that is swollen, or it's a knee joint that is stiff. And it's a really long code, but it tells the funder exactly what it is that you are doing or dealing with and why. And then, of course, the codes that you've applied when managing that. And if we start documenting that data, then it would be easier to see, is ice a better intervention compared to exercise, compared to ultrasound, for example? But we don't have that information.
And that specificity of data, I think, also goes a long way in improving trust between the different stakeholders.
Absolutely.
Because now, I mean, obviously, in the private sector particularly, there seems to be a lack of trust between the funder and the provider. some people have been bad actors and they maybe bold in error or abuse the billing system perhaps, and so the measures need to be put in place. But the specificity, I think, will provide a level of trust where we can tell exactly what the pathology is, exactly what we're treating, and the coding that complements that then makes more sense. In the value-based healthcare ecosystem, you have your patient, you have your provider, and you have your funder. And I think it's important that all of those players do play together. What do you think that the SASP or physiotherapy in general can do to almost, because the conversation will eventually become financial, to financially express that value? Because that's ultimately what that value is looking at. How can we show the quality, and how can the SASP show or put those outcome measures in place that definitively show and define what impact they actually make?
So one of the projects that we have been working on at the Society is to actually develop a database where we capture information. So therapists out there can access an outcome measure, for example, the lower back pain scale, and it's captured in a central database that is then at some point used for economic comparisons in terms of, how often did the patient come to see you, did they improve, did they have to be referred back to the doctor. And with that information, if it's accurately captured,
that's the key.
Yes, I might add, we can definitely make a difference and show our value. In Australia, they've done a study like that, but obviously they have better resources and they have the databases already, and they can draw from that, and that is what they're using to actually showcase the value of physiotherapy. And, as in COVID, we did kind of come to the forefront in terms of what it is that we are doing and what a difference we are making. I think that did work in our favor as a profession, because we were able to show that we are actually making a difference. And I think we need to take it a step further in terms of showing people that we don't just work in the hospital. We don't just work in an outpatient setting.
We don't just do massage.
And we don't just do massage at the side of a sports field.
Correct. Yes, because that is the most marketable, or what is used as one of the more marketable elements of physiotherapy.
Yes, absolutely. And I mean, 90% of the students that come in would say, I want to be a sports physio, but then realize there are so many aspects of it. And I think that the same is true for other healthcare professionals. They don't realize just how much we do and how much we can assist with, which is non-invasive, firstly, and can actually save the patient a lot of time, trouble, and pain.
And when you're having a value-based conversation, this might be something worth highlighting, because some of the interventions down the road are considerably more expensive. We're talking about interventions where the patient has to go to theatre, interventions where they have to be in hospital for a number of days, where expensive medications have to be consumed, and assisted devices where if the condition can be caught early enough, you might be able to save those costs down the line. So from a value-based perspective, this is something that should definitely come to the fore. But I want to ask you, do you think there is sufficient collaboration between the different societies and associations? Do the associations talk to each other?
Yes, they do.
Okay.
So at the moment, we have the rehab in Durban, and all the professionals are involved there. We have the Dentistry Association coming on board, and we have the Biokinetics Association coming on board as well. And in that forum, we actually discuss how do we take our professions forward, especially on the NHI front, but also from a practice point of view. How do we promote rehabilitation? And I say that very cautiously, because many people have the impression that we come in after the fact, not realizing that we have a big role
in prevention.
In prevention, yes, and community participation as well.
You are also a researcher. You have a number of publications out. I was actually quite shocked when I did a bit of research on you to find out the number of publications you have. I thought myself I'd better study. Make sure. So I'm very happy when you said that when you began the podcast, you're talking to Natalie, and I'm just a person. So I thought, okay, fine, I can relax down a little bit. But with that being said, oftentimes when clinicians graduate from university, the distance between practice and research seems to become wider and wider and wider. And it's such an important component of being a competent and up-to-date clinician and therapist. And so my question to you is, apart from the obligatory CPD points that one has to get, it's oftentimes seen as this afterthought. Okay, I just need to get a couple of points.
Yeah.
Whatever's the easiest course to knock down, I'll do, and I'll get my CPD points. How can we reignite that passion, particularly in the private sector, for clinicians to go back to research? Maybe even breaking it down to its smaller parts, because we think that research might be an all-encompassing thing that takes over our lives, but it might be able to be taking place over a number of years. What are some of the things that you found, because you're also in private practice, that allow you to still be able to contribute to the body of knowledge?
It's simple things. Again, it comes back to educating our clinicians that they don't have to be doing a degree to publish a paper. And it could be something as simple as a very interesting case that you feel you need to share the information, and with the right guidance, getting involved in that.
Yes.
Also exploring the different kinds of interventions that we are exposed to, because it is changing. What we are doing is changing. How we are doing is changing. What we understand physiotherapy to be is changing. And the only way that you can keep up with that is by reading.
Yes.
But also exploring and, again, documenting well what you are doing and starting to look for trends. So if I have a good database of my own and I start seeing a trend towards, let's say, if I do this routine, it doesn't have as good results as this one. Yes. And having all the latest machines is not really necessary for me to be effective. Can I go back to the principles of exercise and make a difference there? And what is the impact? And, before exploring anything new, to actually read about it. What is really nice is that a lot of journals are now putting out infographics.
Oh, lovely.
Yeah,
okay.
So it's short and sweet.
Basically summarizes the research in a
Exactly,
picture.
yes, yeah.
Okay.
And you can see the benefits straight away. Is this something that your patient falls into? Is it not?
Yes.
And then Physiopedia has also released an option where you can say, you give your patient case and it gives you options to read. To read.
Go deeper, yes.
Yes, and to explore in terms of what outcome measures are most appropriate. How do you measure change? How do you document it?
Yes.
I think that is also a big area where we need more developing in report writing and accurate report writing.
Yes.
Yeah.
I do want to bring the conversation to NHI though, and as president of probably one of the largest societies and associations, medical associations in South Africa, you represent the wants, the needs, the fears of a large contingent of clinicians out there. I would love to hear what, from your side, are the honest reactions or fears and concerns of clinicians out there about NHI, and what steps are you taking as a society to sort of tamper down those fears and take practical steps toward a working implementation of NHI? So that's just those first reactions and practical steps.
Yeah. I think lots of people are afraid, mostly because they don't understand it. It's well over 180 pages that you need to read before you get to the gist of it.
Yes.
And even then, some of the policymakers themselves don't quite understand how it all fits in together. So the initial document made no mention of therapists in any means. So that was one of the first steps we took to get involved and to make them aware that we need to be mentioned. We are part of the team, and you can't not say that you're going to refer to a physio or psychologist. We are part of the team.
Correct.
And we are part of the patient's journey. And yes, doctors and nurses are essential, but they add to life, or they lengthen life. We add quality to life.
Correct.
In whichever capacity that may be. The fears that a lot of the clinicians have is, what will become of my practice? How do I fit into the bigger picture? And the truth of the matter is, we are going to be doing exactly what we've been doing. We're just going to be seeing a lot more patients who really need it, and who often have to wait 3 months, 6 months to see a physiotherapist.
Yes.
for something as simple as low back pain or osteoarthritis of the knee. And the point is that we are trying to reach more people through NHI, but I do think that there's not enough education of the healthcare professionals about what it's going to mean. And even if you do raise the questions at the big meetings, the answer is never really clear.
Yeah.
But we have launched the Universal Healthcare Project at the SASP. So we've got 2 tiers to it. One is looking at how we can make a difference, investigating how the funding would work, and how therapists or practices would be selected to participate in it. And the other part is the research, and within that, starting to embed our outcome measures and embed, service delivery, with the aim of understanding which areas have high demand, for example, stroke.
Gotcha.
Stroke rehabilitation, which areas are more prone to head injuries or spinal cord injuries. When we were studying, it was very clear because we knew which patients went to which hospitals. It's not as clear-cut anymore. And step-down facilities have had to be closed because there was no funding. Yeah, so from that perspective, we are really advocating for physiotherapy to be heard and to be seen as adding value.
Yes.
And with this in mind, we do submit publications, we do submit reports, and we make sure that we do participate when there's any invitations to comment on important documentation.
So what you're talking about is a lot of collaboration between a lot of stakeholders here.
Yes. Yeah.
You're talking other societies, you're talking the HPCSA, you're talking the Department of Health, you're talking actuaries to do the financial modeling, you're talking medical legal to handle all of the compliance areas.
Yes.
You're talking maybe in some cases accountants, to assist as well with some of that financial modeling, healthcare economists. There seems to be so much complexity to this. How are we going to be able to take practical steps forward to really be able to make sure that communication is coordinated? Is it just taking every step every day as it comes? And do you really think that we're going to be able to have a functional, all-encompassing NHI within what we've been told will be less than a decade? Do you think it's going to have to roll out slowly?
It's going to have to roll out really slowly because you still have to get the buy-in from the healthcare professionals. You still have to educate your public on how it's going to be implemented and what it actually means for them.
Yes.
So at all the forums that I've been to, I've raised the question in terms of, have you informed the public what this actually means for them?
They can't just go and walk into a Netcare tomorrow.
Exactly, yes. And the answer has always been a resounding no. Which means that half the planning is not done.
Yes.
Yeah. So, in all honesty, I don't think it will be rolled out in the next 10 years. It might take longer for that. Also in terms of getting pushback from healthcare professionals. I think purely because they are not being included in the talks around how this is going to work and how this is going to impact them. Yeah. One of the big steps, and that our private sector group actually assists with at the moment, is accrediting practices. So what this means is they look at your premises, they see, do you meet the standards? And it's aligned with the occupational health standards of the Department of Health. And do you meet the standards?
Yes.
What kind of patients would you be able to see? So are you an orthopedic practice or are you a general practice? If you're a general practice, you're more likely to get more patients coming through your practice. The bigger your practice, the more patients you'll be coming through your practice as well. And how that impacts service delivery in the area.
And I can see that too, that accreditation being utilized by the Department of Health, for example,
yes.
as a measuring stick of, okay, how do we allocate this now?
Yeah.
So those early toolings that the SASP is now creating is essentially doing a lot of the work for them. We can say, okay, let's collaborate with this body. They have an accreditation system that is vetted, that is tested, and we now have a way that we can responsibly allocate patients depending on their pathologies.
Yes. Yeah.
Okay.
So we were trying to be proactive through that, and we are now collaborating with the Occupational Therapy Association, where they are wanting to come on board and see how it works and get their practices accredited in the same way.
That's wonderful.
Yeah.
a way, or sort of a mirror, a way we can find out how this might work is you have a couple of managed care programs at the moment that are going around where physiotherapists are participating. You've got Hospital at Home, you've got JSP, where costs are essentially controlled, and you're able to determine how much, number one, how much reimbursements you're going to get, what your treatment plan will look like, in other words, you can plan your sessions going forward. And you're able really to give a more all-encompassing service to the patient. But this has met some criticism as well. And in some cases, some are locked out of the system and some are allowed into the system. I just love your opinion on what the managed care space looks like right now. Perhaps what's good about it and some things that can be done to improve managed care in South Africa.
Yeah, so I think in terms of managed care, it needs to be opened up to other people because generally those are the ones that need it more and would save the medical aid a little bit more.
Yes.
And I do think it also needs to be opened up to more physios or healthcare professionals who are providing the service. So getting the word out there in terms of how to get onto the program and how you are going to be supporting your patient through their journey, but then also educating those professionals on how they can advocate for more sessions if it's needed, if the outcome measures speak to that.
This goes back to outcome measures again,
Yes.
so now we're back at that
Yes.
conversation.
Yes.
Yeah, so.
And how they can align the two and write an effective report to, advocate for that. And by even keeping that statistics, the funder can see, actually, there's a higher demand for more sessions, let's adjust.
Yes.
So keeping an open conversation around that funding as well is really important.
It's critical, yes. I want to take it back to technology as well. There are lots of tools that can assist us with documenting, that can assist us with outcome measures to some extent, clinical care. But there's also an ethical consideration here as well, where we're talking about data and data sharing. Oftentimes, practice compliance isn't where it needs to be in terms of how they handle data, how they process data. And so that does leave patients open to potential data leaking and those kind of things, which is obviously a contravention of the POPI or POPI Act. How do we navigate those waters, and how do we find the perfect balance between technology and utilizing within our practices, while at the same time practicing good data governance?
Education. I think it's important to let people know what they are missing, and encouraging them to actually do the courses. So one of the things that we are saying to practice owners, for example, if you're looking to employ a new or newly qualified physio, have a look at what courses they've done and make recommendations. And as they complete courses, you can then open up avenues for them in terms of being able to do more in your practice. And then also educating them about the importance of maintaining ethical standards, Declaration of Helsinki, making sure that you're looking after your patient. We've also started speaking to our insurance brokers, CFP, and they are doing a series of webinars on cybersecurity specifically.
So important.
Yeah. And how to manage it, how to manage breaches, how to understand what it is that you're collecting and why you're collecting it. We're also seeing that consent, just simple consent, has now changed from, here's a piece of paper explaining what I do, just sign it, or here's a piece of paper, sign it if the medical aid doesn't pay, you will pay.
And there are different types of consent as well.
Exactly,
Yeah.
yes, yeah. And we're moving towards one where you actually have to go line by line and explain to the patient exactly what it means, and for them as a patient, but also for yourself as a physiotherapist or as a healthcare provider, and the impact it could potentially have.
Yes.
And adding in the component of, I'm collecting your health data, and your health data is going to inform practice going forward. It informs how much I can assist you and how much your funder is actually going to pay for going forward.
That's so important. There is something I'd also like to speak to you with regards to technology, and that is, as technology improves within the therapy space, robotics are now also on the cusp of being utilized. physiotherapy is a very hands-on profession. Your hands are on the patient when you're mobilizing them. Your hands are on the patient when you're treating them on the table. Your hands are on the patient when you're treating them in the ICU. Physiotherapy is known, in fact, the logo is two hands.
Yeah.
Do you think it's a bad thing that as technology advances, that hands-on approach might not be as prominent going forward? Or do you think that there's a healthy balance to strike between the two? And how do you manage that?
There's definitely a healthy balance that we need to strike.
Yes.
And I say this because we have lost the idea that we need to empower our patients to look after themselves. So yes, we are very hands-on up until a point, but you've got to allow your patient to do their own healthcare regime. And I think this is also the cusp at which funders become very edgy, because can this patient do the exercises on their own? Or do they need somebody counting out loud for them?
Yes.
And when you talk about robotics, we had CPM more than 20 years ago. It worked. It's still working. It's the same thing. It's just it looks different. It sounds different. It's managed differently.
Yes.
So, and it's never replaced what we do. We still got to go in there and strengthen the patient. We've still got to go in there and understand how this is impacting the way the patient is walking, standing, moving, and then target those muscles when we are exercising them. So, yes, healthy balance, but also remember that my end goal is to make sure my patient can take care of themselves.
Yeah. Natalie, thank you so much for sitting down with us. I do want to give you an opportunity to speak to us about the work that the SASP is doing in helping the profession move into the next digital era. And I think the importance of maybe working together to try and create a more healthy, more sustainable, and more value-based healthcare system. Please, go ahead.
Yeah. So as a society, I've mentioned that we engage on different levels, and we ensure that we give feedback to our members. And, you know, there are some open forums where we do share information, for example, feedback from an NHI meeting. We do have e-commerce if there's specific information that people want to, get a hold of. But in general, we advocate for the profession on different formats. We are trying to strengthen our public sector area, where we're giving better support to our public servants.
Wonderful.
In terms of how they are represented on different platforms, especially higher up where they don't have as much say. And then also giving them opportunities for cost-effective education, collaboration amongst each other, because we find that because of the fragmented way that our healthcare system is functioning, you have your district levels, provincial levels, national level, but they don't speak to one another.
Wow.
Yes. So we're trying to bridge that divide and getting people to talk more on better forums. We have mentorship programs with our community service physios, and we've now also launched career pathing, where we try and help young physios understand what are the options of having a physiotherapy degree and how do you take it forward. But, also emphasis on how can you make a difference. There's been a big move away from you need to pay for my time. I can't volunteer my time because I paid for my degree. But it's also about understanding that if I do my bit, we do move the profession forward.
Yes.
And that's where I come from. It's like giving a bit of your time to make sure that as a profession we are still standing in 10, 20, 30 years' time, and that we are stronger together. And as you said earlier on, there's strength in numbers. So the more people we can get together to work for the profession, the better.
The better,
Yeah.
Just how can people get hold of the SASP? How can they get hold of you personally if they want to chat to you?
Yeah. So at the SASP, it's president@saphysio.co.za. Otherwise, it's natalie.benjamindamons@vits.ac.za.
That's it. And the SASP has a website as well.
Yes, it does.
saphysio.co.za.
Yeah, that's
Fantastic.
correct. Yeah.
Well, thank you again, Natalie. I really appreciate the time. Your insights have been invaluable, not only for physiotherapy, but I think the allied health and medical community at large. Just hearing how you are going about tackling the different issues that face healthcare in 2024 and beyond, and the proactive mechanisms you've put in place to really tackle things from value-based healthcare, NHI, private practice, state care, and the very life and essence of physiotherapy going forward. So thank you so much for your time. I really do appreciate it.
Thank you very much for having me. It was good.
Well, thank you so much for taking the time to watch or listen to this episode of Vital Insight. It's been a really inspiring episode where we got to learn a lot about how societies and associations are taking healthcare forward into 2024 and beyond. And we look forward to welcoming you to another episode of Vital Insight. Thank you so much. I've been Basil Johansa. We'll see you next time. Take care.